Hi, this is Derek Miller, President and CEO of the Salt Lake Chamber and the Chair of the Utah Economic Response Task Force. Thanks for joining us for today's Task Force 10, where we spend 10 insightful minutes with business, government, and community leaders talking about the impact of the coronavirus crisis in Utah. And today we're joined by the President of Regence BlueCross BlueShield of Utah, Jim Swayze. Jim, thanks for joining us.
Derek, thanks for having me today at a socially distanced way here.
Jim, I understand that Regence offers insurance in Idaho, Oregon, and Utah, of course, some of the states that were impacted most by COVID-19. Why don't you start by telling us about what you're doing to make sure that you're keeping your employees safe?
Sure, Derek. As you mentioned, we have a strong presence here in Utah and Idaho, but also the Pacific Northwest. And up there, we have a big presence in Washington State. That was one of the first documented places in the country for coronavirus. Regence, as a result of that, we've been very proactive and very much ahead of this curve. For example, we went to full remote working across all our states beginning on March 6th. And really tried to take things from a proactive state with that. We also have been working with our employees. I think we're all getting used to the new normal of Zoom meetings now. And, we've been trying to make it okay for our employees where suddenly a child or a pet pops out of nowhere. And what I would say is initially we saw people that were very stressed out about that. And what we tried to say is that's okay. Don't worry about it. And sometimes actually it breaks up, a tense-filled meeting. So we've been really working on that human side with our employees. What we really know is we have to take care of our employees so that they can take care of our members. Our employees have to be mentally healthy. We've done a number of other things like liberalizing policy so people can have a better work-life balance. And also, again, continuing to let them know that behavioral health and other resources are available to them.
I love what you said about remembering and even emphasizing that human element. I remember early on, one of the very first Zoom meetings I had in the first couple days of working remotely, someone who was on the Zoom call had a 2 or 3-year-old come into the room. Everyone sort of tensed up for a moment, but then the 2-year-old climbed into his dad's lap and the meeting just went on. It was actually really, really nice to see that. So I'm glad that you're focused on it. In addition to being a company with employees, you're also an insurer, and everyone is focused right now on their health care, what is covered, what may not be covered. Tell me about some of the things that Regence is doing to remove the barriers and to help people feel more secure in this environment.
Yeah, absolutely, Derek. Our North Star is our members, and we really like to keep our members at the center of things. We were the first health plan in the state to actually cover COVID-19 testing at 100%. What we did later on is added actually to where we're picking up 100% of member out-of-pocket costs for any of our members that have been diagnosed and are going through treatment of COVID-19. The rationale here is people have enough going on, with this dreadful crisis, and we really want to ease their burden if they have that situation emerge. We've done a number of other things, throughout the organization. One is removing barriers on prescription drug. So normally when someone gets a refill for prescription drugs, there's a period where they can't refill that drug. And what we're trying to anticipate is if there's any ever issues on supply chain, we're allowing people to refill faster. I can say that this affects me personally because my daughter, who is 22 years old and not with me here in Utah right now, has type 1 diabetes. And I've asked her to really keep, with insulin, a slightly larger supply on hand just to be safe. We also have been doing a lot of outreach to members. Some of those members may have COVID-19, others may be just high-risk members, to check on them from both health and also from a mental health perspective. And then also, extending prior authorization for elected procedures. So if we had a member that prior auth something, and because it got moved or got rescheduled, we're not going to make those members go through prior authorization again. We're actually going to allow that to extend, which is very important. So a lot of these things, again, just to make things easier for our members, and we continue to look for other ways to do the same.
As a percentage, more people in Utah get their health insurance through their employer than almost any other state. And this is an area where Regence has been on the cutting edge for a long time. What are you doing to support employers at this time to make sure that their employees can continue to get that health coverage?
Yeah, it's a great question, Derek. A lot of our employers are suffering right now, and that's really hard for us to see. I know it's hard for you to see from the chamber. And we've taken a lot of quick action. One of the things that we've done is we rolled out a whole comprehensive policy around how employers, if they need to, can do mid-year benefit changes. So some of the employers are going to need to do mid-year benefit changes and possibly bring benefits down several notches so they can still afford benefits for all of their employees. The other thing that we're doing, we had embedded in our contract a leave of absence policy, and we're letting our employers know about that leave of absence policy as another tool where they may enact that. And then we're also working a lot on communication. We have so many good things going on in this state. We see the brokers and consultants as very much partners with the employers. We've been doing a lot of education with both the employers and the brokers. One, letting them know what we're doing, but two, letting them know what federal and state resources. Things have been happening so quickly that we've been really trying to be a conduit of that information. We did some great things in the state here, and how quickly Val Hale and his team rolled out the small business loans. And that was really heartening to see. And we've been talking to our employers and small group brokers to let them know that that's available and how to apply. And we're also excited in the second round that not-for-profits will be covered. And we're actually getting on the phone with all of our not-for-profits to let them know that this new help is available. So there's a lot of things that we're doing out there. And again, we continue to look for other ways. But I think it's changing policies and then also, trying to communicate and make sure that information is getting out there properly.
So we've talked about what you're doing to support your employees, and we've also talked about what you're doing to support your customers. Let's talk for a minute about what you're doing to support those who are working on the front lines, those healthcare providers, those doctors, those nurses, those technicians, all those people who are putting themselves quite literally in harm's way every day in order to combat COVID-19. Tell us about what you're doing on that front.
Yeah, this was another area where we were very quick and proactive to respond. We actually are paying for telemedicine or virtual visits at the same rate as a regular office visit. Normally, a telemedicine visit is reimbursed to the provider at a reduced rate. Why did we do that? Well, what we wanted to do is really support the providers with that higher reimbursement rate, but also promote safety and really, slow the rate of infection. So that's one thing that we've done. The second thing is we've always been known for paying claims quickly, but we're actually working even harder on that. Provider cash flows are in a really difficult situation right now because all of the elective surgeries have really gone away, and appropriately so, and really focusing on the acute parts of COVID-19. So we're paying claims even faster than what we have had to do in the past to keep that provider cash flow going and healthy. I think the other thing we're working with providers on is just relaxing policies where it makes sense. We don't prior authorization have requirements there for COVID-19. We're working on faster discharging with our providers of patients that can go from a hospital bed to a less acute type scenario. And what we're doing there is trying to free up beds that may be badly needed in a crisis type situation. So a lot of things that we're doing with our providers. Also, I mentioned with our members that we're extending prior authorization for elective surgeries. And for the providers, this helps too, because they don't have to worry about going back and, having to recertify a surgery that was already approved. So we continue to support legislation also at the national level for relief for the providers, which is also badly needed.
You mentioned nonprofits earlier. Many people may not know that Regence is a nonprofit, and you are joining with other chamber members, including nonprofits, to support the community. Tell us about that.
Yeah, and we're a little bit different with that. We are actually a tax-paying not-for-profit, which puts us in a very unique space. The not-for-profits, like many other sectors, are really in a tough position. I can tell you we work very actively with many of them. I'm on the board of the Ronald McDonald House. We have a gala coming up a little later this month in April, and we are rapidly changing the gala, from one of the largest galas in Utah to a virtual event. And we're doing this by lending our business expertise and flexibility. And that's something I would encourage everyone to join us on April 25th for this wonderful virtual event. Yeah, so we have also been reaching out to our community providers. We have also been working on things like food insecurity. Fresh into the crisis, we actually did a campaign with all of our employees in all of our states to really promote food insecurity. What we did is we took donations, and we're actually matching that 100% through Regence, and we're getting those into the local communities. We're also advocating for caregivers. And this is something, Derek, that I was really appreciative. I sent you an email just last week talking about our partnership with Archangels. And what we're really trying to do here is to promote awareness of the frontline healthcare workers. And you responded, it was within minutes, offering your support and the support of the chamber to get this really, really great message out. So thank you for that.
Well, people have sometimes compared our fight against the COVID-19 to a war. I've never been in a war, so it's hard to know where the comparisons start or end, or even if they're appropriate. But I will say that if it can be compared to a war, we know who those frontline soldiers are in this war, and they are those healthcare providers. Jim, my last question to you has to do with Utah being a leader, in which Utah has been a leader in so many ways. We know that prior to this healthcare crisis and this pandemic that we are facing, that Utah led the nation in job growth, had the strongest economy, most dynamic economy, most diverse economy in the country. One of the ways in which we led was in healthcare itself. And so I just wonder if you can give us a national perspective of what Utah is doing and what Regence is doing nationwide to set an example, and not just set an example, but to pitch in and help.
Yeah, absolutely. And that's another great question. We do daily meetings between all of the states in which we operate. And in those meetings, we update on what's the newest and what's the latest and greatest going on in each state. This is the part really that is most heartening for me. I get to share the great things that Utah is doing with some of our other states. And this really helps because we like this healthy import and exporting of ideas to be able to be aware of what's going on. But I'm also, again, very proud to share the great things we're doing. I can tell you that several times on these calls, people have said, wow, that's amazing what you're doing, and have just been very, very impressed. Also being part of the National BlueCross BlueShield Association, we're really in the conversation nationally and trying to influence it on a lot of the key policies, from testing and tracing to looking at other areas, support for providers, and continuing to look for ways that we can, either change benefits or offer employers more flexibility. So lots that we're doing in that area. I want to thank you and also all of the other folks in the state. It's really been amazing to see people step up so selflessly and so tirelessly. I've seen so many examples of just great things being done and people just looking at the problem. And as you said, looking at it as a war and not looking at it through their own lens. So that's inspiring for us, and that really helps us to continue to look at what can we do to influence, what can we do to change, and what can we do to kind of fight this war and make a difference.
I've been inspired by that as well. Jim, thanks for spending a few minutes with me.
Thanks.
I'm Derek Miller. the chair of the Utah Economic Response Task Force. I've been joined today by Jim Swayze, who's the president of Regence BlueCross BlueShield of Utah, and this has been the Task Force 10.